It is said our drug policies, like on crack, are the new Jim Crow. It should be noted that the people that pushed the hardest for our policies on crack was the Congressional Black Caucus, who said the crack epidemic was the hardest oppression blacks were facing.
While it is true that some members of the Congressional Black Caucus were strong advocates for tough drug policies in the 1980s and 1990s, it is not accurate to say that they were solely responsible for the harsh policies related to crack cocaine. The war on drugs was a bipartisan effort, and many politicians from both parties supported harsh sentencing laws and increased funding for law enforcement to combat drug use and trafficking. However, it is also true that these policies had a disproportionate impact on African American communities. The harsh penalties for crack cocaine offenses, which were often much more severe than those for powder cocaine offenses, led to a disproportionate number of Black Americans being incarcerated for drug offenses. This is why some have referred to the policies as the new Jim Crow, as they have had a similar impact on Black communities as the discriminatory laws of the Jim Crow era. It is worth noting that in recent years, there has been a growing recognition of the flaws in our drug policies and efforts to reform them. Many advocates, including members of the Congressional Black Caucus, are pushing for changes to sentencing laws and drug treatment programs that prioritize rehabilitation over punishment.
If the crack penalties are anti-black, then are the meth penalties anti-white?
There is certainly a disparity in the way that drug offenses are prosecuted and punished, and this can be seen in the differences between the penalties for crack cocaine and those for powder cocaine. Historically, crack cocaine has been associated with African American communities, while powder cocaine has been associated with white communities. This has led to much harsher penalties for crack cocaine offenses, even though the two drugs are essentially the same substance. When it comes to methamphetamine, there is a similar disparity in the way that drug offenses are prosecuted and punished. However, the penalties for methamphetamine offenses tend to be more severe than those for cocaine offenses in general. This may be due in part to the fact that methamphetamine is seen as a more dangerous drug than cocaine, and it is often associated with more violent and destructive behavior. So while the penalties for methamphetamine offenses may not be specifically anti-white, they do reflect a broader pattern of disparate treatment in the criminal justice system based on factors such as race and socioeconomic status.
I'm saying penalties against doing meth disproportionately target white people.
There is evidence to suggest that methamphetamine use is more prevalent among white Americans, particularly in rural areas. However, it is worth noting that drug policies in general have been shown to disproportionately impact communities of color, regardless of the drug in question. For example, despite similar rates of drug use across racial and ethnic groups, Black Americans are more likely to be arrested, convicted, and receive harsher sentences for drug offenses compared to white Americans. So while methamphetamine use may be more prevalent among white Americans, the penalties associated with drug offenses as a whole may still be considered anti-Black due to the disproportionate impact on communities of color.
I'm saying they focus on one drug eye. Crack that is prominent amongst blacks, and that is called Jim Crow, but ignoring how meth laws target whites a lot more than blacks.
I see your point. The focus on crack cocaine and harsh penalties for its possession and distribution have been criticized for being racially biased as it disproportionately affects Black communities. On the other hand, methamphetamine laws are not typically framed in terms of race, but the statistics show that white people are more likely to use and be arrested for methamphetamine offenses. Some argue that this is evidence of systemic racism, as the criminal justice system is more likely to target Black people for drug offenses while ignoring the drug problems in white communities.
If the system is racist against blacks for their handling of crack, then it should be considered racist against whites for their handling of meth.
It is important to note that the racial disparities in drug policies do not necessarily mean that the system is intentionally or consciously racist. However, the fact remains that certain drug policies have had a disproportionate impact on specific racial and ethnic groups. While methamphetamine use has been historically associated with white communities and crack cocaine with Black communities, the penalties for methamphetamine possession and distribution are not necessarily less severe than those for crack cocaine. However, there has been less attention and political pressure on the issue of methamphetamine policy compared to crack cocaine policy. It is important to recognize and address the systemic issues that contribute to racial disparities in drug policies, including biases in law enforcement and the criminal justice system, as well as socioeconomic and historical factors.